Thank you very much, Deputy Speaker. I thank the member for Laylaw for her motion. It is true that Medicare is at the very heart of our healthcare system, but unfortunately the ideal of universal healthcare is fast becoming a mirage. Universal health coverage means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. The reality is that Medicare has been undermined by years of rebate freezes and rising costs, and Medicare schedule fees remain unrealistically low. Australia's ageing population, the growth of chronic health conditions and our increasing mental health needs mean that GPs are having to schedule longer and more complex appointments. Average consult lengths have risen, which reflects the increased complexity of those consultations. But the fees schedule forces GPs to prioritise short consultations over complex ones and to charge significant out-of-pocket fees to patients. Female GPs, on average, spend more time with their patients, so they're disproportionately disadvantaged. Unsurprisingly, medical graduates are deserting general practice for the specialties. According to the recent Health of the Nation report, 9 out of 10 specialist GPs regularly manage conditions that would typically be managed by specialists because patients have to wait too long to see specialists or because they simply can't afford to. Multidisciplinary team care in primary health clinics is valued and is expanding. More than half of our GPs engage in MDT care. 2/3 say that they'd like to participate more, but workforce shortages, lack of funding and infrastructure gaps remain limiting factors for this type of care. Tragically, in Melbourne, just this week, I've been contacted by a number of constituents concerned about the imminent cessation of GP services at 3 co-health community health clinics. These clinics serve vulnerable patients with complex needs, including refugees, people facing homelessness and people experiencing family violence. The current funding method does not adequately address the needs of these individuals. The government's bulk billing incentive program commences this week, but for too many GPs, Deputy Speaker, it's going to be too little, too late. The program means that GPs and practices will receive added financial incentives if they bulk bill every eligible service and patient. But while 4 out of 5 GPs in the Health of the Nation report said that they wanted to provide more and better preventative care to their patients, 82% said that Medicare benefit scheme rebates are simply insufficient to allow them to do that. As a result, only 1/3 of our GPs are able to offer preventative care to their patients. Preventative medicine covers a range of services. It aims to identify problems that could lead to chronic illnesses or diseases. So our GPs' inability to provide those services mean that they're going to be struggling to cover all bases in healthcare. They'll be struggling to test blood pressure and cholesterol, struggling to undertake weight management, struggling to screen for cancer and for diabetes, to touch on drug and alcohol diversion programs, on mental health assessments and on nutrition. So the GPs are simply unable to offer us the best care possible because of financial and time constraints. In my electorate of Kooyong, according to the recent Clean Bill report, only 16% of consults were bulk billed in the last financial year. The average out-of-pocket cost for a GP consultation was $49.91. Only 12% of GP clinics in Kooyong are able to bulk bill every patient. Realistically, schedule fees need to double. For standard consultations, that would be the government paying out about $100, and even that's going to be less than the call-out fee for our average plumber. Deputy Speaker, we know young people are increasingly putting off having to see a doctor because they simply can't afford it. These are false and harmful economies. Avoiding vital medical care often results in later and more severe presentations to urgent care clinics or to emergency rooms. If this government really values primary health care, it has to be prepared to have the best primary health care provided to all Australians and to look at new models of multidisciplinary and preventative care within our universal health care system.